Matthew Holt, digital health is no longer for the faint of heart. There are two S1s that got filed. Today alone, Livongo's stock took a 20% swing one way, then the other way, then the other way. I can't deal with this. And then on top of all of it, Brian Dolan from Exits and Outcomes has created basically the PPP blacklist of health tech startups who have applied for PPP funding. Whether or not they're going to pay them money back, we don't know. I can't keep up. It's the July 14th episode of Health in 2.00. Whew!
So Jess, crazy times, crazy day, crazy week, crazy. Are you on the blacklist? Am I on the blacklist?
I'm not rich enough to be on the blacklist.
Yeah, I think you had that 350,000
or on the stock swing list. Like,
yeah,
I don't know.
Well, I know that you were moving the market up and down in that Livongo and Dolan stock all by yourself today.
Yes, that was me.
All right. Pretty crazy. So let's talk about some of the companies who are trying to join them then.
All right, let's do it. We've got a bunch of, oh my God, there's so much going on. And then anecdotally, my friend, Moby Health News reported today, 35 different M&A deals done so far this year.
Wow.
Which is huge because usually that number for the total for the year is around like high 40s, low 50s.
All right, so we're in there. Okay, well, I have a watch, a clock, just 2 minutes on it, and we're going to hit go.
Okay. We're going to just kick things off with a $1 billion deal, Walgreens and VillageMD. Oh, Matthew Holt, what's happening here?
Yeah, interesting. So Walgreens is basically going all in on becoming a primary care center. VillageMD, which has done a lot of different stuff, sort of partly having its own centers and partly managing other people's primary care centers over the years, but really interesting and done a lot of Medicare Advantage and Medicaid work, is going to come in, and we shall see. It's a big deal because they were going to put $250 million in as equity, and about another, the rest of the $1 billion was going to be loans. They built these centers all over Walgreens everywhere. Walgreens stock, which sadly I own, needs some help, although it didn't get much from its earnings. So, we'll see. Big deal, big move in the primary care. As another company beginning with W, which is a competitor, bigger, richer, called Walmart, it's also been doing.
Okay, so what about Go Health? They file an S1. This is one of two we're talking about today.
Yeah, this is in the, back to Medicare Advantage. This is a company which, basically sells Medicare Advantage plans as a broker. And it's been growing really rapidly. I forget the exact numbers, but grew dramatically over the last few years. It's done very well, basically getting seniors to choose between different Medicare Advantage plans. And hopefully we'll see if there is another broker called eHealth, which does the individual market, which has done quite well in the stock market in recent years. So they'll probably do okay.
All right. What about Oak Street Health? Sticking around with those seniors, they filed their S1 also.
Yeah, and this is another big deal. Oak Street, like VillageMD and Iora, which is not yet out, and some others, is another of these companies which has been doing Medicare Advantage. Very interesting breakdown of their S1 by Kevin O'Leary, not that Kevin O'Leary, the other Kevin O'Leary, saying that they're doing okay, but they're not as profitable as he thinks they should be. Interesting. We'll see. I'd like to look into that a bit more.
All right. Doctor on Demand, another telehealth company, closes $75 million D.
Ooh, what are they up to now? 235, 240?
235 is what I saw.
Okay, 235. So, Doctor on Demand's interesting. They're currently establishing themselves as kind of number 3 after the friends at Teladoc and the folks at American. So Amwell, Teladoc, public now and worth, what are they, 20 billion, something ridiculous. Amwell's raised, $600 million, got a big investment from Philips and a bunch of others as well. And they're pretty clearly the top two. The next two down, MD Live, which has raised 130 odd million, and now Doctor on Demand with this number. And then there's a bunch of others that we've discussed. Everyone's doing telehealth and lots of different flavors. Doctor on Demand has been pushing the idea that they can do chronic care management rather than just sort of occasional stuff. And they've got to deal with Humana, which hasn't really played, I think, started to play out yet. I don't think it's been announced. I'm not sure how much they've done with them yet in terms of building that. And Humana, by the way, is a big owner of Oak Street, who we just mentioned, in terms of, and their biggest customer in terms of funneling their. So you kind of see the pieces coming together here. On the other hand, how much of this telehealth maintenance is going to continue when you've noticed the telehealth numbers are coming back down again after the COVID bump up. And they only got to about 15% of all visits anyway, according to the claims data. So was it telehealth craziness? I don't know. maybe the Teladoc stock is telling you a story today. Who knows? However, having said that, Doctors Demand, interesting company, original money from Venrock, bunch of interesting stuff they're doing, and nice people. So I hope it'll work out well.
Is this going to converge with this other trend we're seeing with primary care or not?
I mean, in the end, it's got to, right? Because as I may have mentioned to you, because you named it, there's this thing called the continuous clinic, which essentially is, on-demand, anytime primary care that manages people with chronic conditions and eventually people with acute conditions. And you've got to have some physical human beings who go to the house and stay in their own centers. You've got to have human beings who are monitoring, and you've got human beings who are delivering actual care and intervention online. And all this stuff is going to kind of mush together. Right now, you can see the constituent parts, and you can see all these people milling around. But that's where it's going to have to go if we're going to get proper value-based, risk-based, capitated care, if you want to call it that, which is going to, essentially suck the extra dollars that are going into hospitals and specialists away from them. You were too young, but I remember the 1990s when we tried this, and it kind of worked for a while, and then it didn't.
What made it not work?
Sorry?
What made it not work so we can learn from that mistake?
In the end, the health plans got too greedy, not prepared to give enough risk to the primary care docs. And the other thing that happened is the patients fought back and wouldn't take the sort of the Kaiser constriction on how much access there were to specialists. And the specialists and the hospitals fought back, and they won, and they put their prices up, and in the end, everyone else gave up. There's a much longer story to that, which is probably too long for a Health in 2.0. But if you look at what happened there, that while that was going on, healthcare costs were kind of flat for the middle part of the 90s. And then in the end of the 90s, they started going up. In the whole of the 2000s, it went from about 13% of GDP to about 18% of GDP where we are now. And interesting things tend to happen in recessions. And you may notice that despite the stock market going crazy, we're about, if we're not already in, well, we're in a recession.
Don't say it.
We're going to stay in one. We're going to stay in it for a while. Unemployment is over 14%. We're going to have, God knows what's going to happen.
Bad enough, I'm in a quarantine and a pandemic and an enigma wrapped in a puzzle. Why do I got to be in this too? I'm like just not participating.
The recession is it's like the recession is a bit like the coronavirus. Whether you like it or not, it's going to come and get you.
No, I'm done participating. I didn't want to participate in this pandemic. I didn't want to participate in any of this other stuff. I'm not participating in the recession.
This is not a choice, unfortunately.
Watch me make a choice.
Not a consumer choice. It's un-American. You don't get the choose.
Fine, I'll be un-American. I'm not on board with trying to make it great again at all. Anyway, so what does it matter if I'm not on board with this?
You better get us out of here. This is crazy.
Oh my God, it is crazy. Things have spiraled out of control. And so if you want to make sense of this stuff, why not microdose me and Matthew on a daily basis via Twitter? So follow him at BoltyBoy, follow me at Jess and of course you can sign up for our email newsletter on thehealthcareblog.com. Just click on email newsletter and sign up there so you can get some of the best content from the blog that's seeking to make sense of all of this stuff, curated and bundled into a cute little email and delivered right into your inbox. Mr. Holt, we'll be back again soon because there's a whole lot more deals that we didn't even get to today.
All right. I'll see you soon, Mr. Massa.
All right. Take care, everybody. Bye.